So the kidney embryology. So kidney develop in a three set of the series. First is the earliest one is a pronephros. Second one mesonephros, and third is a metanephros. The first is a mesonephros that develop in the 4 week, and after that it's degenerate. After the pronephrosis degenerate, then the mesonephros is arise. So the mesonephros development start at week 4, and it act as a kidney up to first trimester. So this mesonephron remnant in male has epididymis or ductus deferens. This mesonephros remnant has no role in a female. So the last one is the metanephros. So this metanephros is basically give rise to the permanent kidney. Permanent kidney. So there is a bird that developed from the caudal end of the mesonephros known as a ureteric bird. Then this bird is interact with another structure that is a metanephric mesenchyme. This one is a metanephric mesenchyme. So the interaction of these two structures is important because this ureteric bird induce differentiation in this metanephric mesenchyme, and this metanephric mesenchyme differentiate into the glomerulus up to DCT. And the derivative of the ureteric birds are the ureter, pelvises, calyces, and collecting duct that fully canalize up to the week 4 of the development. So the abnormal interaction between these two ureteric bud and metanephric mesenchyme lead to the renal agenesis and multicystic kidney disease. So the ureter pelvic junction is the junction that ureter and renal pelvis unite, last to canalize. If if this is not canalized, it will lead to the congenital obstruction, can be unilateral and may be the bilateral. Most common pathological cause of the prenatal hydronephrosis detected by the prenatal ultrasound. So as we already know that this ureteric bud and this metanephric mesenchyme, so the interaction of these two structures is important for the development of the permanent kidney. So, so if the pathologies lie in the abnormal interaction of these two structures, the kidney is not developed, and the kidney is important for the urine formation. So the fetal urine is an important component of the amniotic fluid. This amniotic fluid has a multiple function. It prevents the fetus from injury, temperature changes, important for limb movement, and lung development. So if the interaction of these two structure, metanephric mesenchyme and the ureteric bud, does not take place bilaterally, it will lead to the Porter sequence. So the Porter sequence, what is a Porter sequence? So first thing, it will present with a limb deformity, facial anomalies, compression of the chest and neck, lack of amniotic fluid, aspiration into the fetal lungs. It will lead to the pulmonary hypoplasia. So the Porter sequence is basically the oligohydramnios is basically the triggering factor that start these abnormal chain of the pathology. Pulmonary hypoplasia, twisted face, twisted skin, extremity defect, and renal failure. So the causes of Porter sequence, chronic placental insufficiency, reduced renal output include autosomal recessive polycystic kidney disease, obstructive uropathy, where posterior urethral valves and bilateral renal agenesis. So the horseshoe kidney is basically the fusion of these inferior poles of the kidney and it become the horseshoe shape. So what happened? Kidney develop in the pelvis during the fetal life and when they ascend toward the abdomen, it is trapped by this inferior mesenteric artery. So kidney can function normally, but it associated with hydronephrosis, renal stone infection, increased risk of the renal cancer, and the higher incidence in a chromosomal abnormalities like Turner syndrome, trisomy 13, 18, and 21. Here is the picture. Imaging shows that the inferior pole of the kidney fused together. So the posterior urethral valve is basically the membrane remnant in the prostatic urethra. So the membrane remnant in the prostatic urethra, and it will lead to the urethral obstruction here. So what happened when the urethra it obstruction there, the retention of the urine in the bladder, and it will back towards the kidney. It will lead to the hydronephrosis. So this is diagnosed prenatally by the and bilateral hydronephrosis and dilated thick wall bladder on ultrasound. Severe obstruction in fetus associated with oligohydramnios. Most common cause, this is a super high yield stuff. Most common cause, the bladder outlet obstruction in male infant. So the vesicoureteral reflex is basically the reflex that re- backward movement of the urine from the bladder toward the kidney. This is a basically the vesicoureteral reflex is a basically the retrograde flow of the urine from the bladder toward the kidney. So it can be primary due to the abnormal insertion of the ureter within the bladder wall or secondary due to the abnormal high bladder pressure resulting in a retrograde flow. It increased risk of the recurrent urinary tract infection.